Hey, everybody. We are here on Dr. Tim with Sarah Blessing. We are today talking about Medicaid, and it is in the news everywhere. And we've had a lot of questions about what even is Medicaid? How does it work? And is it going to go away? Is it going to be cut? Is it going to grow? And what are the implications for Hoosiers? And Sarah herself has a bunch of questions. And my job today is to explain to her what Medicaid is. And if we can do that, I think you can understand what it is. You excited, Sarah?
Excited, hopeful that if somebody can explain Medicaid to me, it's you, my friend Tim Peck, who explained how we fix healthcare in a way that I understood, and this light bulb went up, and I was like, "Oh, I get it." So I'm hoping for that
All
moment,
right.
Yeah.
Well, cool. Yeah, I'm in scrubs today because I just got off of an overnight shift, which is amazing. And so, of the patients who come into me in the emergency department, um, about 20% of the adults are covered by Medicaid, and about
Wow.
30% of the children are covered by Medicaid.
Oh, wow.
So Medicaid is the healthcare coverage of a little more than 20% of Hoosiers. And so it's a lot of us, right? A lot of us are using this for our insurance. Medicaid's just insurance. It's just insurance paid by the government. And therefore, it's paid by our taxes. And it's insurance that's paid for those who can't afford it for one reason or another and are below the federal poverty line. Or there are other pieces of Medicaid where you do pay a little bit more into it yourself, but you still get a lot of coverage if you're 150% of the federal poverty line. How are we doing so far?
I got it so far. So you can
Okay.
get a lot of coverage if you are making under a certain amount, and you can get medium coverage if you're making one and a half of that amount.
Yeah, and still, it's pretty extensive coverage.
Does this
If you're
include like
one and
the state? Does this include the state coverage? Indiana has its
mhm.
own type of health insurance. Like,
Yeah, so this is why Medicaid gets a really confusing, is because Medicaid is a program that's uh, a federal program that's run by the states, and each state gets to decide within some rules how they administer Medicaid, how they do it. So all 50 states have different Medicaid rules that are completely different from one another. What is the same is that the federal government pays a large portion of the money for Medicaid, and then the states match it. All right. So,
okay,
right. So, and in Indiana, it's about 70-30. The federal government pays 70% of it, and the
oh,
state government pays 30% of it.
okay, I did not know that. So the
Right.
state ran health insurance that I know a lot of my friends use and rely on, and it seems pretty decent, is covered some by federal, some by state. Mostly federal, a little smaller amount state. Okay, I did not know that.
I'd say it's pretty decent for a number of reasons. One, um, is Medicaid successful compared to being insured versus insured by your health plan if you're employed? Or is it successful versus not being insured at all? Right. So that's what we have to look at. Is it worse than being insured by your employer? And is it better than being not insured at all? That's the big question on the mind that's out there. And so, is Medicaid even worth it? Is it good for people? Does it work? And so, I'm going to give you some numbers, which is pretty cool, showing that it actually very much really facilitates access to care, allows people when you have it to have access to care versus when you don't have insurance. It improves health outcomes, and it helps people have financial protection and not go into medical debt. And so, on a high level, yes, it works. It's not quite as good as your insurance from your from your employer, but it's much better than not having insurance at all. And I'll give you some numbers around that, but I want to say that. But on a higher level, even, it's important to realize that it's really expensive to be unhealthy.
Right.
It is really expensive to be unhealthy.
It's
And
expensive for the person, it's expensive for the health insurance company, and then if the government is supplementing any of that, it's expensive for the government.
absolutely, it's expensive for everybody. So it's expensive for the taxpayer, it's expensive for the government, it's expensive for the individual. If you are unhealthy, you will be poorer. If you are poorer, you will be more unhealthy.
And
If
if
you
you
have
are
no
poor,
insurance,
it's expensive to be poor.
and it's expensive to be poor, right? It's just, and these numbers bear out over and over and over again. It's not just a nice thing to say, like a nice idea to, say for left-leaning people to say, oh, it's really expensive for people to be poor. No, it actually is. And so, um, let me show you here. The uninsured people of America um, delayed filling their prescriptions due to cost by 5%. 5% of them last year delayed or didn't fill prescriptions because of cost. And if you're on Medicaid, 1.7% did. So you're 5 times more likely to delay filling your medications if you're not insured. So
Well,
Medicaid does.
we saw the horror stories, or at least I did. They reached my social media news feed when insulin was so expensive. People were rationing their insulin, and some of them were dying from not having enough, not using enough because they couldn't afford their insulin medication. And I'm really impressed with like the public pressure put on, because I know some health insurance companies, or not health insurance, some medicine companies like Lilly, it used to be Eli Lilly, cut their prices, and I think we capped some of it, didn't we? Didn't we
Yeah,
cap the cost
that's
of
because
insulin?
of a federal mandate that happened in last administration during the Biden administration, where it capped the price of insulin at $30.
So that
Yep.
literally, that right there, that government law, that change saved lives. So now
Yeah, that's
people can
government
hopefully
at work.
better afford insulin.
That's right. And so, but wait, these private companies aren't going to make as much money off of insulin, et cetera. But, for the greater good, as you think about it, that insulin allows people to live, yes, but having controlled blood sugar leads to less heart disease, leads to less strokes, leads to less obesity, and what we call metabolic syndrome. So, people having lots of problems because of the obesity. Insulin does all those things for individuals. And these are the major, not only killers of people in the United States, but these are the major things that make us sick and have to use the healthcare system a lot. When people don't have insulin, I see them in the emergency department, and you, Sarah, pay for it.
I have
You are
taught
literally, your taxes pay for it when they
I've
see me.
taught kids that had type 1 diabetes, and so I went to trainings and I knew a lot about it. And it's stressful enough, you all, having a fifth grader that has type 1 diabetes, and they are mostly in charge of what they're doing. You just kind of monitor and make sure and know the signs if they're not doing well. To add on how expensive and hard to get all of their medicine is another thing. It's hard enough for these parents and these kids. Let's do what
Yeah.
we can to help them. Is how I feel.
Type 1 diabetes, also known as juvenile diabetes, or early onset diabetes, is really hard on families. And it's hard on kids as their brains are developing. Their sugars are up and down. You know what you feel like when you're low blood sugar, right? Imagine that happening even more so, on a daily basis, and having spikes in sugar, and you're going, and it just, the hormones plus the sugars up and down, it just makes kids have a really tough time. And they get the stigma of having this thing stuck on their arm that's measuring their blood sugar, or they have to excuse themselves from class to give themselves shots. It's a really bad thing. And these kids need coverage. So, Okay, so we do get delayed, and then I said I'd also compare it to if you have health plan, if you have employer coverage, and
Right.
so it's 1.7% of people with Medicaid delayed getting medicines because of cost, and 1.1% um, if you had employer coverage. So not that really that much of a difference. So starting with that one, but the question is, someone not see a doctor that they
Mm.
were referred to because of having Medicaid or no insurance or what? And so for those people who are insured by their employers, about 4%, 3.7% had not seen a doctor because they said it's too costly. I can't do it, even though they had employer-based health plan. Medicaid was 4.8%. So not that much more. So, but still 5% of people saying, I'm not going to see a doctor, it's too costly. If you don't have insurance, those who didn't have insurance was 27.4%.
Oh, wow. So a lot of uninsured people are choosing not to see the doctor when they should, so they're most likely getting worse
Yep.
in a
And
lot
they
of
get
instances.
sicker until they're so sick that they come see me in the emergency department.
And
And
then
we
it's very expensive, right? I mean,
It's so expensive. And it's not just
and
one
what if you
visit
need to
you're
call
done.
911 and get an ambulance? Like,
Yeah, and that's the thing that's really easy to like think about, like, oh my God, I have to call 911, there's an ambulance, that's a big cost. There's the whole trip in the emergency department, they fix me up. But what happens is that after they see me in the emergency department, now they need to see so many doctors. They need to see so many have medications that may or may not work because their metabolism is out of whack. Have to try to put different medications on. They get sick from them. It's not just over after the emergency department. There's all this stuff that has to
it's
happen.
not like you're gonna get fixed immediately when you go in there,
No,
right? I mean, I think you would
no,
like to, as an emergency room doctor, you'd like to see a patient
yeah,
and just be like, "I can do these few things and bam, you're all better."
right. And so, we stabilize them, but there's stuff to do as an outpatient, and um, it's hard. And if you don't have insurance, it's really hard to find healthcare. Um, we have some great places here in Southern Indiana, LifeSpring being one of them, that will see uninsured patients and be helpful. And, we give those numbers out to people who don't have insurance often. But it's also sometimes difficult to find care if you are, if you have Medicaid, because not all doctors accept Medicaid. Uh,
Oh, I didn't know
that's,
that.
hmm hmm and so if you have insurance from a employer, you have about only 1.5% people don't have what's called a usual source of care, basically a primary care doctor that they can have access to. If you have Medicaid, 3.7%. So, double that of people with Medicaid can't get access to a primary care doctor because it's too hard to get in. If you don't have insurance, that's 23.6%. So
A
one fourth,
few That's
fourth
insane.
people without insurance can't get a primary care doctor.
And that makes such a difference if you're seeing the same doctor that has all of your records, that knows more about you, that you know that doctor and how to talk to them, and you're more comfortable, you get such better care, especially if you're seeing a good doctor. Not all doctors are created equal. I had this random virus like a year before I had the twins, and I could barely stand or move. I had all this pain. Basically, I'd had a virus with a fever for 24 days, and then about a month after that, I had inflammation from it, and my primary care doctor left, and I hadn't gotten a new one. And so I set up a new one, and they fit me in 5 months after I was sick. So I kept going to, like, urgent care, and I found one decent doctor at the urgent care that would try to help, but after it all ended, we found out it was this weird virus that I got that affected my body, and it made it I had to basically take 3 Advil. I just set my alarm 45 minutes before I got up, take 3 Advil so I wouldn't cry when I used the restroom. I was in so much pain.
Mm,
So, like, just, like, not being able to have answers to that, and it was very expensive to go to urgent care and not get answers, you know?
yeah, absolutely. So, I'm just going to preface the statement with I'm always very careful not to violate HIPAA rules, et cetera, when talking about individual patients. And so, don't give any identifying information. I change information sometimes when telling stories completely, change their sex or change their, whatever it might be. So whenever I'm talking about something, it's usually either um, an amalgamation of, a combination of other one patient,
So this
some
isn't one specific
one.
example of a real person, but this is in
Exactly.
general what happens so that we
Yeah.
can learn. Got it.
But this is a specific example, but I won't violate any rules by saying this, which is um, this was over in the last month. I had met a patient, and they were adamant that they hated doctors, but they were having pain and needed to be seen, and so it just got so bad that they needed to be seen by someone. And they said, "I just hate that. I don't want to be engaged with the healthcare system." And they needed to see a doctor, so there they were. As I discharged them, I wrote on the paperwork the best way to avoid the healthcare system is by seeing a primary care doctor, right? Is by engaging with a primary care doctor who can see you once a year, who can be there to take your phone calls. It is so important to have someone that you can just kind of have a relationship with, that can change medications over the phone rather than going to urgent care or whatever it might be. It makes your entire life better and makes you not have to wait in waiting rooms, go to emergency departments, urgent cares. Primary care is extremely important for the management of your own life. So that's my PSA for today. Um, all right. Postponed seeking care due to costs. So postponed the actually seeing a doctor, not just the medicines. We talked about the prescription medicines. 0.5% for those who have employee-based healthcare, 0.8% for those who have Medicaid, and 9.7 for those who have no insurance. So
Wow.
you're 10, 20 times more likely to not see a doctor when you need to if you don't have insurance. But this is the one I really wanted to hit on, and we'll get away from these numbers now, because it's about the same for Medicaid and employer based care to have access to a doctor.
Hmm.
So by giving people Medicaid, you have literally a 12-fold less um, chance of you have 12-fold better chance of getting to see a doctor. So access to healthcare is incredibly important. Medicaid allows for access to healthcare, and access to healthcare decreases costs for individuals, decreases medical debt for individuals, keeps people above the poverty line if they can, and keeps them employed. Medicaid keeps people employed. Believe it or
Because if
not.
you're too sick, you can't afford a doctor, so you don't go, so you get sicker, and then you can't go to work.
Yes. And I can't stress this enough, that Medicaid keeps people employed. And we have a test case in Arkansas in which they put on um, made work mandates on people. And by doing that, it actually made people less employed. People lost their jobs because they
So,
lost their Medicaid and they couldn't stay employed because of it.
okay, so this is frustrating me. I already knew some of this, but can we talk a little bit about what's going on in the government?
Yes.
Because I feel like we're talking a lot about Medicaid right now because the House of Representatives, which you ran for this office in November, and Erin Houchin stayed in her seat, and District 9 in Indiana representative. And what happened? So they're trying to cut Medicaid, correct?
Yes, they're trying to cut Medicaid. So the House put together what Trump's called this one big, beautiful bill, right? And the health portion of it was a large portion of it. And the Energy and Commerce Committee was mostly responsible for putting this part together. And they had to find a lot of dollars in order to cut healthcare costs. They had to find a lot of dollars somewhere because the one big beautiful bill has tax breaks for mostly the wealthy and corporations, also for everyday people as well, mostly the wealthy and corporations. And that those tax breaks would have put us into terrible, even more debt than we already are. And so they said, okay, you got to cut stuff, you got to cut programs so we can offset the tax breaks.
Tax base
Well,
for the rich and a little bit for regular people.
and for regular people and families, yes. So there are some in there, but mostly it's for wealthy people.
But if you lose your Medicaid and you get a tiny little tax break and you have giant medical bills, it seems like it
Yeah,
doesn't really equal out.
no, it does not. But so here's the thing: in order to really find the money to offset the tax breaks for the wealthy, you'd have to gut Medicaid completely, or cut Medicaid, but also cut Social Security and Medicare. And Medicare is the program that we have for mostly those people over 65. And politically, Republicans who were writing this didn't want to touch Medicare. They didn't want to touch Social Security, but they thought maybe we can get away with touching Medicaid. But there wasn't enough to cut. So this big, beautiful bill is going to cost the United States $3 trillion.
I can't even fathom how much money that is. No, I
This
mean,
is the least fiscally responsible. And you saw I wrote an op-ed in the um,
News and
News
Tribune.
Tribune the other day saying like this is I don't how is this at all fiscally responsible? How is this conservative values? And how is this fiscally conservative values, a lot of which I uphold? And if I'm missing something, kind of reach out, please. People, reach out and tell me. No one's been able to reach out and tell me what I'm missing here.
Erin
Uh,
Houghton isn't calling you and telling you. I mean,
now,
she
and
voted for this. She voted yes for this.
more than voted yes for this. She's on the Energy and Commerce Health Subcommittee, so she's
Oh,
part
I
of the
didn't know
architect
that.
that made this thing.
So
And
she could have helped make this bill less terrible. She has like actual power in this
I
committee
mean,
thing.
it got passed 215 to 214, so her vote could have, just like any Republican, you need one Republican to stand up to this thing. So there were
Our
two that
our
did.
our friend of Project Next,
Yeah,
Tony Hostetler, who works for Hoosier Action, he flew down to DC to protest this, to try to stop. He asked for meetings with Erin Houchin to try to talk to her, to try to explain how it would hurt people in her district. And I even saw a video that went viral when people in wheelchairs went through Congress and they were saying, don't vote for this, don't vote for this, and they wheeled right past Erin Houchin, who sat there and smiled politely and watched them go past as she voted to take away their Medicaid. Like,
yeah. So let's talk about what exactly is being taken away. Uh,
yeah,
and so uh, there's about 500 billion dollars, a little more, being cut from the program. And where is this? I'll start with the most complicated first, because I'm just going to say it a little bit and kind of wave hands and then move on, because it's
okay,
so complicated,
okay,
which is something called provider taxes. There's this loophole that states have been using forever that should definitely go away, but has become so entrenched that no one's been able to have the political will to take it away from the states, that the states use to get more money from the federal government. And the way they do it is, instead of um, charging you $100 for the physician visit you just had, they charge you $100 plus they put on a provider tax of like $10 onto it. And so the transaction now is $110 really, that the state is paying me, the physician, rather than 100. And remember, what the program is of Medicaid is state pays some stuff and then the federal government matches it. And so if they have these provider taxes, which are really just phantom dollars, it makes the federal government, from the formula that exists, have to match it and pay more. and it's a way of getting money out of the federal government. So this is one good thing that the Republicans in the Trump administration did here. They said, we're done with this. Stop this ridiculousness. Like, we're going to stop this provider tax thing. And that's going to save $86 billion from
Okay,
doing
so that's good. That's
it.
nice to hear something good.
Yeah. Yeah. And so they'll have to make up for it in some way. The states will have to figure out a way to do that from their own budgets in some way if they want to. But using a loophole that some states use, some states don't, some states are good at it, others it just doesn't make sense. So that's a good cleanup provision. All right. The worst one for me is making Medicaid harder to be eligible for or renew.
Okay.
And they're doing that not in ways that are having anything to do with need. All right. And you'll hear in the news that, like, oh, these are people that don't need Medicaid. Well, I'm talking about people who need Medicaid. So enrollment into Medicaid usually stops in January 15th. In some of the Medicaid programs, I should say. They're going to stop it on December 15th instead. And they're just taking a month away. And right now, 40% of the people who enroll into Medicaid enroll after December 15th.
So unless they learn about this new change, they're going to miss out on reapplying, and all of a sudden they're going to be without health insurance.
And they won't have health insurance for a year until they can enroll again.
So for people that are listening that are in Medicaid this year, they need to re-enroll in December?
Before December 15th, if this gets passed.
If it gets passed. Okay.
It's passed.
Okay. So you can let us know if it gets passed, and so we can try to tell our
Either
family
way,
and friends.
get enrolled before December 15th, right? Make sure that you're doing that rather than waiting till. But usually this kind of stuff happens. People do it right at the end of the year, right at the beginning of the year. It's just when kind of paperwork like this gets done.
So it seems like a sneaky way to try to prevent people that need health insurance from getting health insurance.
Yeah, it's in no way related to, not having immigrants do it, or not having people who are not working, or taking away the ability of people who are abusing the system or some way. It's just simply trying to make it harder to get a coverage that you need.
The other thing that really bothers me about all of this is the amount of paperwork to file for Medicaid or Medicare. Like, I watched my mom do it for my parents, and I could not believe how much work it was. And they had to have like a lawyer help them. And I just am like, wait a minute, aren't we supposed to rely on the government that we pay into to help us? I don't understand why it's so complicated, other than it makes it so some people don't use this service because paperwork is stressful and hard.
Yeah.
So
And
that frustrates me a lot.
New bill has more of that. It makes more paperwork, makes more requirements. It takes some of the stuff that you have to report every 2 years and makes it that you have to report it every year.
Ugh.
So that if you miss it, you'll be kicked off. It's just makes Medicaid eligibility and renewal more difficult.
But you're saying when we have Medicaid and we have access to it, it saves money on the taxpayer. It saves our government, our country money when our citizens are healthier and are seeing a primary care doctor. So I would imagine the other side is saying, we're not saving everybody, you need to do it yourself. But it ends up costing us in the long run when these people are not as healthy. They have to wait to see a doctor. They have to call 911, get an ambulance, go to the ER. They get these expensive bills they can't pay. They're even more unhealthy now, which is more expensive. They can't work. So then the government has to help them. So if we could just stop and say, even if you don't empathetically care about human beings, but you care about money, if you put in the work and make things better and give people access to Medicaid, it saves the country money.
That's right. And I would phrase that last part a little bit differently around money, because I think a lot of people who think about money, and that's the way they frame life and look at the world through economics, et cetera, are thinking about that in a way of saying, okay, money is what makes the world work. And so therefore, if you change money around in such a way, you will help people. And so even if you're thinking that way around the finances of it, and seeing it as a humanitarian thing, seeing it as something that can boost economy, seeing it as something that can grow, the greatness of America, etc. This doesn't. This hurts American prosperity, and
Right. And
it's
don't we
borne
want our
out
country to
in
thrive
number
and
after number.
continue? Right. Okay. That says it. Well, yeah, thanks. Yeah. So I like how you're breaking it down and rephrasing it, because I feel like the people that are saying yes to these bills and trying to get them passed some of them think they're doing what's right for us. But
Mhm.
you're explaining it simply, no, it's not. We should actually take care of people. That's morally the right thing to do, but also it benefits our country and keeps us thriving, keeps us on top in the
Yep.
world.
This will
Yeah.
make the country poorer, and it will make individuals in this country poorer.
I see that. I live in Palmyra. It's
Right.
a neighborhood I love very much, and I see my friends and their kids not going to the doctor because they don't have adequate coverage. And I'm seeing their problems get worse. So like a kid will come over and tell me about, his back hurting, he had a back injury and stuff like, and it's like I can't fix that and it makes me mad. I bet it makes you mad too. It's like this kid should be able to go to the doctor and get his back pain fixed.
Being unhealthy is expensive. Being unhealthy is expensive, and it's expensive for all of us. All right. So, um, what happens if you didn't have Medicaid because you missed the cutoff, and now you
Okay.
have to go a year without it? There are these emergency funds that you can qualify for when you're in an emergency moment. Um, it's complicated, doesn't always work. Lots of restrictions around it, as you might imagine. People might go into debt before those funds ever come in. Hospitals, don't get paid for a long time before it's a mess, right? You don't want to deal with something after the fact it's happened. That's the whole point of insurance, is to have it all set up beforehand. And so it does exist, but it's not great. This new bill, one of the things it does is okay, currently Medicaid, if you are an immigrant, documented legal immigrant, you can't have coverage for Medicaid for 5 years. Um, and that's kind of makes sense. If I'm an American and I go move to Spain, I'm not going to be eligible for their health insurance for many years. I don't know what the exact rule in Spain is, but for many, many years. Canada is, I know it's a very long time. You have to be there for like a decade or more before you even get their healthcare, right? So when people say, I'm going to move to Canada because I don't like what's going on here, well, you don't actually get the benefits of Canada by doing that. So they've been there those people have been paying into it themselves, and they're not just going to give it to you because you got there. So, that's the way the system works. And so what happens is, right now, if you are an immigrant and you've been here legally documented, etc., gone through all the process, and you don't have health insurance, but you go to the hospital, you can get that emergency coverage if you are a child or a pregnant woman, because we in America have decided that we should cover children and pregnant women who are extremely vulnerable and unable to, sometimes get money for themselves. This new bill makes it so that you can't do that.
What?
Yeah.
Okay, that's just very upsetting.
Yeah. I
Okay,
don't know.
so this new bill is going through the Senate right now, correct?
It's into the Senate. They're looking at it, marking it up. I have great hopes for it, actually. I get in a lot of debates about this with a lot of our Democratic colleagues around. I think that the Senate has a lot of kind of moderate Republicans that can help really, even if the bill passes, change the bill significantly to look like something else and take some of these really bad parts of it out of it. Susan Collins in Maine, Tom Tillis in North Carolina, Lisa Murawski in Alaska. There are others here that are kind of swing votes who are going to lose their jobs if they let this happen, right? They're not going to get reelected. And then you even have like people who are usually associated as kind of far right, like Josh Hawley, who is upset about this because Medicaid is extremely popular in his state. And so he's trying to represent them in that way. And so I just don't see all of this stuff staying. But this is the agenda of Trump and the agenda of the House Republicans, right? So and of many of the Senate Republicans. So there's going to be a lot of political pressure to do so. So
And House you elect every 2 years, and Senate is every 6.
yep,
So they don't have quite the pressure of maybe MAGA people. They might not, some of these people are not up for reelection for a few years. And so maybe that will give them more bravery in stopping the worst of this bill. I mean,
yep,
because they set that
yeah,
up, the 2 years and the 6 years, on purpose to try to give some protection to our lawmakers to do the right thing.
yeah. I know Susan Collins is up next, I believe next year. So she's one who's going to have a lot of pressure on her. It was up pretty soon in 4 years, in 3 years, is Todd Young here in Indiana, who has been, I wouldn't call him a moderate in any way. He's a conservative, but he's done some voting, done some things. He didn't endorse Trump during the primary for him. Right away, he has done some things that are very pro-science, the CHIPS Act. He's a conservative who has shown himself to be somewhat reasonable, pretty reasonable at times. And so when I talk to people about their phone calls and they want to call their senator and stuff, I say the thing that you say to Todd Young should probably be different than what you say to Jim Banks or to Aaron Houchin, right? To Todd Young, it's like, guy, you got it. You have this. Like, you have the moral compass. You are a conservative. I get it. Do the conservative thing. This bill is not conservative. What are you doing? Like,
Right.
are you really going to vote on something that's going to put us $3 trillion further into debt? That's the argument for him, right? Is to maintain his conservative values as he's done it. And so I think it's just important to realize that, not every Republican is the same and where they're coming from.
I've also heard Todd Young is more willing to talk to people in Indiana, that
Oh,
it's
for sure.
easier to get a hold of him than like our House of Representatives, who is only in charge of 1/9 of the state, has 1/9 of the constituents, whereas Todd Young has the entire state. I've heard it is easier to talk to him. I've met people that have talked to Todd Young in person, and they've asked to speak to Aaron Houchin and have not. So that is another favorable thing. You might be able to talk to him.
It's just the hypocrisy, right, of saying you're conservative and then doing a not conservative thing and then trying to somehow push it past everybody.
Well, then just ignore everybody is what a lot of our elected officials are doing. They just ignore us. They just
And
vote.
so
Yeah.
Todd Young hasn't done that. And so if he votes for this bill as is, then he's just as bad as the rest of the people who are being hypocritical about this.
Well,
And so I think this is our hope in Indiana, that we can have a senator who will kind of stand up to this bill. And I think he'll want it to go through at the end because there are a lot of conservative values in it, but he'll want it to change. And so we have to ask him to work on changing it.
I'm interested, once this either gets voted into law or doesn't. If it passes in the Senate, then Trump would sign it and then it would become law. If that happens, you look at what happens and come back on the Dr. Tim show and explain it to everybody, because we don't understand. It's going to be giant, right? It'll be like hundreds of pages of confusing words that are going to affect our lives. So I appreciate that you will try to research it and figure it out and then explain it to us, because it is scary. It's so much uncertainty.
So the Medicaid eligibility and renewal stuff. Hey, buddy.
I have my.
Bye, bye, Dad.
You leaving? Bye-bye. You saying bye to everybody?
Bye, bye.
Bye.
The way go. On the way go.
You're live on a podcast right now, bud.
My kids are watching the Minecraft movie that we just bought.
Bye, bye. On the way go. See you later, Dad.
Bye-bye, buddy. I love you.
Oh, you gotta come with me.
Cutie pie.
Um,
Cameo.
yeah, so commercial break for whatever he was wearing on his shirt. I think it was a Notre Dame shirt. So this making it more difficult to be eligible for Medicaid and people getting cut and taken off of the enrollments, et cetera, is going to save $162 billion. $300 billion is said to be going to be saved through putting work requirements on. And work requirements on mean that you have to work 80 hours a month to get Medicaid. So that's part-time, 20 hours a week, and you have to get that done. I just want to say, we talked about this has been done in Arkansas and shown that it actually didn't work. It didn't make people more employed by asking them to get employed. The people who, once people get sick, if they're not working, it's almost impossible for them to get a job. If they have a job and they lose it and therefore can't be on Medicaid and then can't re-enroll for a year and they get sick, they can't get a job. Work requirements don't work. Whether you philosophically believe that someone should be working to get their Medicaid or not, putting on work requirements has not been shown to actually work for people and make people more employed.
Do you think the people that get to pass this bill know that? I mean, why?
Absolutely.
did
They've all been told. I mean, why they know it is there's something called the Congressional Budget Office. This is where all these numbers come from. So some people, where are your sources? Where are you getting all these numbers? The Congressional Budget Office. It's a nonpartisan group of economists that are hired by the Congress. A Congress, by the way, that's controlled by Republicans in both houses, right now. So it's not like Democrats are even hiring, have the hard control over this. But that's what the Congressional Budget Office. They're nonpartisan, and they use the best evidence that's out there to come up with these numbers that we're talking about. Nothing is predictive. It's all, nothing is like making it up out of the air. There has to be hard numbers that have happened in the world, and then they can extrapolate from that. So they use the Arkansas program that happened to get these numbers and to see that people do not actually become more employed when you put working requirements in place.
Because it sounds like people that kind of might not want to give away stuff to other people, like, "Ooh, I have to work hard for it. They should too." I get why they think this sounds good. It's like they have to work. If they're going to get our government funded health insurance, they've got to work. But the evidence shows that you can't force people, especially if people are sick, to work to get the health insurance.
And in fact, because people, when they become disenrolled, when they lose their jobs and are looking for new jobs, if they get sick, especially if they become disenrolled because they lost their job because they're sick, are less likely to become employed after that.
Yeah, that makes sense. Yeah, I've met people who got sick and they got fired. And it's like, wait, I didn't even think that was allowed to happen. Oh, it happens. People can get sick and they get fired for something that they can't help.
Yeah. And so this doesn't include children, by the way, right? This doesn't include children. And so I've heard that in some kind of left-leaning circles of like, we're cutting children because of these requirements. And that's not true in terms of these work requirements. Some of these Medicaid eligibility and renewal difficulties, it does make it harder for children to get on. So, all right. And so that is supposedly going to, save $300 billion is where that number comes from. So that is, what this new bill is proposing. There are about 70 other rules for Medicaid that it's proposing changing, but really they're all kind of go up into those three categories. This provider tax thing that closes a loophole, which we do agree with. quite a bit. The Medicaid eligibility and renewal restrictions, which is just terrible in a lot of ways. And then with the work requirements, which I think you can have work requirements for Medicaid and do it in a much more surgical way for people. And it would require investing in people's in case management, but investing in people's social determinants of health, which Medicaid also already does. So if you can't get a job because you're sick and you need transportation to the hospital or to the doctor so that you can get better, well, Medicaid can pay for that. And so we should be investing in ways to get these people better so that they can work. Like thinking about it as not just chopping them off because they're not working, but instead investing in their health so that they can work, so that it's cheaper for them and it's cheaper for all of us for them to be working rather than them not be working is what we need to do. This is the whole thing of like it just costs money to be poor. It costs money to be unhealthy.
Yeah. I was listening to some Obama quote that just popped up on social media. I think it was Instagram. I saw it. And he said, government handles the problems no one else wants to solve.
Mm.
And we need to be electing people that want to tackle these problems for the better of humanity. And that's what I hear from you. You are trying to say, here is what works. Here's what saves the country money. Here's what makes people better. Let's get them care so that they can work. Let's use facts and numbers and science to solve. Those are the types of people I wish we could get elected into our government and that would do the hard work
Yeah.
that no other company wants to tackle.
I think it's hard for a lot of politicians to get the messaging, a lot of Democratic politicians get the messaging right on this because they might not understand the specifics of it very well. And so the messaging often is like, work requirements are really bad and we can't be having people have work requirements, right? We can't, and it's like, it sounds like you're saying, well, why wouldn't you want them to be working, right?
Right.
Instead of saying, we need to invest in people being able to be healthy so that they can work.
I wish our elected officials would stop just fighting and saying your idea is bad. No, your idea is bad. If they would just talk to each other and make their ideas better.
Mhm.
Because you're saying this idea isn't great, but we could change it to make it better. Well, why? Let's do that. Let's make that idea better. We could do it now. The Senate could do it now. It is frustrating.
And needs to. And I think it just gets around to making sure that everybody wants to get people back to work. I mean, I don't know a stump speech in America that's said where someone doesn't talk about getting their constituents jobs. We want to get people back to work, and the best way to do that is make sure they're healthy.
Right. Okay, I think this is a really good episode. I just want to say last night at 7, I had a really good episode with a Get the Word Out show with Kerwin Olson, who's the executive director of Citizens Action Coalition, and they are trying to help our energy bills not be so expensive. They're trying to save Indiana. It was a great conversation, and we left with positive things we can do to try to save Indiana from these energy bills and from what these energy companies are doing to our state. And we could just pass legislation that could fix some of these loopholes and some of these bad bills. And so it was really good for him to explain to us what are the bills. And it's interesting, they've been around for like 20 years and they actually have passed legislation that really saved Indiana, but a lot of those have been stripped away over the last few years. So I learned a ton from that. You can catch that. And then I did a show with Ellen Kelly yesterday. She's a retired therapist, and we talked about what do we do when we're anxious and stressed from all the political uncertainty, which this Tim Peck seems to be part of that stress, this Medicaid, this bill that's sitting in the Senate's house right now. So you can catch that. If this has stressed you out in any way, go back and watch it. We were at a park outside with the wind blowing, talking about it, and it was a good conversation. And if you have any questions, you all listening about Medicaid, about what's going on with these with this bill, feel free to drop it in the comments and I will send it to Tim myself so that he can explain it to us.
Yeah. One thing I just realized I didn't say, what is the kind of effect of this on people? 10.3 million people will lose their Medicaid across the country. At the end of 10 years, after everything kind of settles out, that means about 7 to 8 million people will still be uninsured because they won't be able to find another insurance program to go under. And for Indiana, it equates to about, the range is large, but somewhere in the low 200,000s of people that will lose Medicaid once this bill gets passed.
That's a lot of people. That's a lot of Americans. I hope that doesn't happen. Would you suggest people that live in Indiana calling Todd Young, emailing and say, please be conservative, stick to your morals and your values? Would you suggest that?
I think that's the message. I think Todd Young's your biggest bet here. I think Jim Banks is just going to do whatever the Republican leadership wants him to do. He's hasn't really shown himself to be much of an individual in terms of how he's acting. He's acting just straight whatever leadership wants. So, and the Senate leadership's very different than the House leadership, right? Senate leadership, Thune, McConnell, these people are conservatives for sure, but they vote against their own party sometimes to keep them in line. So Todd Young also does that, also has worked across the aisle somewhat, especially on science and health bills. So I think he's our best bet in Indiana to make sure that, I think, again, he'll want the bill to go through, but he can change a lot of this to make it a lot better than it is.
Especially since he's on a committee that has more power over this, right?
So Aaron Houchin was on the committee that.
Okay. Sorry, that was Aaron Houchin. I got confused. Okay. Well, darn, that stinks. Hang on, buddy. I'll be there in just a second. You look very cute. Okay. So you guys, please share, subscribe, like, and send this to a friend. Send this episode to someone that is concerned about what is Medicaid, what is going to happen. Hopefully this eases your anxiety. I think it's better to just know the truth instead of just hear all these scary fear things like our media is pushing out. Here at Project Next, we want to tell you the truth is the best way that we can and cut out the division. So hopefully this made you feel better, but now we need to just teach it to as many people as possible.
Yeah, and you have a way of actually making action right now as it's been passed from the House to the Senate, which is call Todd Young, tell him, hey, stand up to this bill, change it, maintain your conservative values. You can't just vote for this thing as it is.
And if you're in another state, contact your senators.
Your senators right now, or who you need to see. You can contact your House members and tell them you're mad at them for doing this, but
they've already done it.
So cat's out of the bag on that one.
It helps to know that we are watching them. It helps. I know sometimes it seems like they just put blinders on, but they feel the pressure. They feel it. So the more we are aware, the more that we are letting them know we are watching them, it can help save people's lives in our country. Yeah.
Do you know Ethan Sweetland May? Can we give a shout out to someone who's been in?
Yeah. So Ethan, hopefully he's going to be on the show soon. Ethan Sweetland May lives in New Albany, and he has been newly involved in local politics. And he is a new friend of mine, and I'm very, very excited that Ethan has joined us. So yeah, we'll get him on soon. Thanks for watching, Ethan. And thanks everybody. Hope this helped you all. Tim, when's the last time you went to sleep?
I slept a little bit last night, but I am, post overnight shift, and I am going to bed in about half an hour. So excited about that.
I hope you have a good night's rest. I think that was really nice of you to do this before you went to bed to try to help people, because
I realized it was already Friday and this bill is so important. And next week, the news cycle might move on for a little bit. So people need to know, the facts, the truth, and what they can do. And what they can do is call Todd Young. And again, if you have the News and Tribune, please check out on Monday. I wrote a letter to the editor about this that got published. And I think it sums it up in a nice, 400 words, not 45 minutes. So, or 54 minutes, I should say. So yeah, please take a look at that too.
Right. Thanks everybody. And we'll see you soon. I'll be back. I've got shows on Tuesday and Wednesday lined up. I don't know when you're doing shows, Tim, but I've
I
got
don't have
2
them
on
scheduled yet, but
Tuesday.
we'll do a priest and a doctor walk into a podcast next week, but we don't have it scheduled.
Sounds good. Okay. Have a great weekend, everybody. Love you guys.
All right. Bye.
Bye.